Over the past 10 years, we have experienced the most important technological revolution in history. The new technologies that were previously produced by large multinational corporations are more and more within reach of all, regardless the geographic and language barriers, distance or money. The benefits of the application of these new technologies are clearly reflected in the development of many solutions in the fields like medicine, agriculture, governance, education, not to mention the important development of communication in its many forms, which are playing day to day an important role in the development of humanity. Information and communication technologies include an enormous quantity of applications and have thus been regarded as a reference point for cataloging all their applications in an environment of generating and transmitting knowledge based on documentation, processing, and dissemination. But talking about technologies for development represents a greater responsibility, as one has to pay special attention to the application of these technologies for the benefit of human development, focused primarily on the reduction of poverty in its different forms, including itself when we talk about the digital divide, poverty in the development and application of technology. The limitations of poor countries distract attention due to the financing research and development, which further reduces the growth rate of the implementation of new information and communication technologies. The so-called digital divide is not, however, the problem, but rather the result of other more significant divides in terms of human development, social development, governance, democracy, etc. These are what impede poor countries and the world from taking advantage of the immense opportunities represented by ICTs. In order to reverse the current trend towards unsustainable development and an unsustainable world, the new technologies have to be incorporated into the global and national development agenda. Their application and massive use must be encouraged in social projects and programs as an indispensable element of their implementation, breaking paradigms that have divided the world into cultures, regions, countries, languages, etc. But the technologies alone are not the solution. The proper application of them is what facilitates the achievement of sustainable results. CARE International in Ecuador over the last 8 years has begun incorporating ICTs within the traditional implementation of its projects and programs, such that the ICTs have been applied to their development in many ways, focused on the implementation of a strengthening of partners and beneficiary organizations, the utilization of different resources to carry out the institution's own activities, as well as the development of new technological solutions. The development of specialized software made it possible for a number of institutions that provide healthcare services to improve their administrative and healthcare processes, their sales of services, the costing of processes, the control of hospitalization, as well as enhance their customer service practices in the different healthcare centers where the Apollo information system was implemented. Apollo fulfills the information generation requirements for the control entities of the central government and also maintains international protocol and diagnosis standards. Apollo has been tested in private institutions as well as in the public sector. Siglo, Local Government Information and Management System. Siglo has been implemented in 14 of the 210 municipalities of Ecuador, improving the processes related to tax collection, accounting, treasury, and service to the public, and make it possible to increase transparency in public administration, create new ways of participation, decrease transaction costs, time-consuming procedures, create new operational and strategic possibilities, increase efficiency and productivity. In 2004, CARE receives an award recognizing Siglo as a technological innovation to reduce poverty.
CARE, deploying technology to reduce government corruption and promote social justice. In rural Ecuador, local governments do not have standardized systems of record-keeping, causing inefficiency and a lack of accountability. As a result, corruption among officials is high, and local governments are mistrusted. CARE realized that a computer-based system would allow local governments to serve their citizens more effectively and help eliminate government corruption. They developed Siglo, a financial and administrative software package ideal for use in impoverished remote municipalities. With Siglo, it is easier for local governments to plan and manage public funds, while citizens have the official records they need to hold their governments accountable to the local community.
Sijupare, based on Siglo Information System, an information system model was designed for local parish governments, in which their information management requirements are limited to accounting, budgeting, and inventory. Sijupare allows rural parochial boards to ensure the quality of information that they report to the Ministry of Economy and Finance. Sijupare is implemented in several communities seriously affected by the continued eruptions of the Tungurahua volcano. CARE led the GOBEL project as a promoter of the development of technologies among the local governments in the country and managed to strengthen the effort in the form of the GOBEL Consortium, made up of the Association of Ecuadorian Municipalities, the Consortium of Provincial Councils of Ecuador, the National Council of Parish Boards, the National Council for the Modernization of the State, the Ministry of Economy and Finance, the ARD3D project, and CARE. The objective of GOBEL is to promote the development of and application of optimal technological tools, allowing the central government and governmental institutions, provincial and local governments, and the public in general to have access to the necessary channels to obtain timely, precise, clear, and efficient information for making decisions, assessing the management and control of costs, and ensuring accountability. Ventana Ciudadana. The right of access to public information is a right of all citizens, as stipulated in the Law of Transparency and Access to Information. Nevertheless, its application using the Internet is limited considering the weak connectivity coverage in the country, where only 3.5% of population has access to the Internet. Ventana Ciudadana is a local tool for the public to have access to public information in the local government facilities, thus allowing for a closer citizen-government interaction. CARE is member of the Consultative Council for the Construction of ICT's National Agenda, chapter of e-Government. The Consultative Council for the Construction of ICT's Political Regulation in the Ecuadorian State. IT Department provides advice on the use of technologies for care programs, HIV, tuberculosis, local governments, education, others. Sale of ACT's services, administration, and support to ACDIBOCA, PRODEL, which is considered another option for resource mobilization.